I want to welcome everybody. My name is Jacqueline Pitts. I am the Director of Communications here at the Kentucky Chamber of Commerce. And we are excited today to have a panel of experts from both the recovery and the employer side today to talk about recovery in the workplace. Obviously, some of the biggest struggles that we have in terms of our fight against addiction and other things is people feeling safe enough to come forward and say they're struggling and get the help that they need. And that's why it's so critical that employers play a big role in this. So as the Kentucky Chamber, as well as the Kentucky Chamber Workforce Center, we wanted to make sure that we are getting this message out there to help employers figure out how to take those first steps and be a recovery-friendly workplace. So I am not going to do a whole lot of talking to begin with. I'm going to let each of our panelists introduce themselves and talk about their role in this space. And I am going to start with Patrick Coleman.
Make sure I unmute before I start talking. All right, well, good morning, everyone. Again, my name is Patrick Coleman. I'm the Executive Director of Landmark Recovery here in Louisville, Kentucky. I'm also an interventionist, and I have my own intervention company as well. And then I'll also will be representing, I guess, what it looks like from a person in recovery. I've been in the workplace at a large employer here in Louisville where I struggled with substance use disorder and asked for help in the workplace. And then I've also got the point of view from the person in recovery, helping other people that are in the workplace getting into treatment.
And if you don't mind, Patrick, I've heard your story once. I'm sure a lot of people haven't. If you don't mind to go ahead and tell your story of recovery, I think it would be very impactful for everybody to hear.
Yeah, I'll just give a real quick rundown of it. So for me, substance use was something I struggled with the majority of my adolescence. About 13, 14 is when I started dabbling. And by the time that I was 18 years old, I was using drugs like fentanyl and heroin and pain pills and things along those lines. Hadn't really gotten really out of hand yet. But long story short, I got this amazing job at Ford Motor Company. And it was something my parents' friends got me hired on, got me a referral, and it was a big deal and everyone was really excited about it. And then something happened at work one day. I bent over to pick up a part and my stomach caught on fire. Long story short, I had an umbilical hernia. And with a hernia, you get sent to medical. With medical, you get sent out for surgery. With surgery, you get pain pills. And like I said in the beginning, I had dabbled with a lot of other substances in the past, so I wasn't new to the pain pill world. But once I started getting them prescribed to me on a regular basis, it became very evident that my addiction had taken off. People always ask the question, how does somebody get on drugs like meth or heroin? How does that ever happen? It happens like this. So I got prescribed some pain pills. They were a low milligram pain pill, and I was in a lot of pain. And so I was taking them in abundance and running out. And the doctor said, oh, well, you're going to need a higher milligram so you don't run out. We have to get you a refill. So I got a higher milligram, and then it progressed, and then the highest milligram they could offer me was available, and I was still running out. And then I started buying pain pills from people like at work or on the streets, and it gets very expensive. Pain pills are about $5 or $6 a piece, and at that point in time, I was taking about 10 to 15 a day. And at some point, I had developed about $150 habit a day of pain pills. And it became a cost savings benefit analysis is the way I always try to describe it. How do you get into heroin? Well, you can spend $150 on all of these pills and have all of this extra Tylenol and stuff in your system. You have to eat through all of these chalky pills, or you can spend $10 on this little bitty amount of heroin and get the same desired effect for a lot less money. So it was a cost savings benefit analysis for me. I ended up saving a lot of money. I'm a coupon clipper in the first place, so I always try to cut corners when I can. Never thought I would view heroin as a value drug, but it kind of was. And so that's kind of how my story progressed. And people always wonder, what do you do? How do you pull yourself out of those kind of situations? It takes a village. It takes a family, it takes a unit. It's not something that's done on an individual basis. I've noticed, in the beginning when I first started telling my story, I talked about me a lot and the things that I've done and the trials and tribulations that I went through. But now looking back, I'm about 6.5 years sober now. I've noticed how big of an impact my family, my employer, my therapist, the treatment centers that I went to, how all of those things were factors into getting me to where I'm at today. So kind of in a nutshell, I was that employee at work who was struggling with substance use disorder and ashamed to say something about it. And it progressed to the point to where I almost died because of it. I was contemplating suicide, to the point to where today I try to be that voice for the employees, the voice for the addicts and alcoholics that are coming into treatment and not sure what they need or how things work. Ford is a great example. I have employees that come through from time to time from Ford, and they are distraught, they're worried, they're concerned. And the reality of it, they shouldn't be. They have their FMLA, they have their short-term disability, they have their ESP rep, they have people fighting for them in their corner. And what I always try to remind them is, I need you to focus on you. We will focus on your job. Let us worry about the background noise. You focus on the main picture, which is getting better. And that's about it.
And I really want to thank you for sharing your story. It's so incredible to hear people come forward and tell their story, and it's so impactful to help other people too. And I think that, just to your point, I think that's why it's so important that we started with you, just so that we hear that there are people who have their jobs. I think a lot of times people think when people get to the point where they're using heroin and things like that, they weren't employed and stuff like that. That most people, as we're finding out, who struggle with substance use disorder are employed, and we'll get to more of that. So again, for sharing your story. And I look forward to hearing more from you on this panel. And we are going to move now to Amandafaulkner, who is with LG&E.
Thank you. Good morning. I agree. I think I learn something new every time Patrick tells his story, and it's still as impactful from the first time I heard it, which was at a KHC event, and I'll never forget it. So very much appreciated for that. So good morning. I am Amandafaulkner. I'm with LG&E and KU Energy, representing the employer side of this. I actually kind of got involved with this through the Kentuckiana Health Collaborative in participating on their worksite addiction group, and then have since joined the panelists with the Chamber of Commerce. Mental health, behavioral health, all of that. I have a strong passion for that. We all have our story in some form or way. And I think we're all learning that through 2020, which we never saw coming, that journey is still continuing for all of us. And so just look forward to the discussion today.
Absolutely. Thank you. And the first time I heard from Kimberly was at our recovery conference 2 years ago, where I also heard from Eric Bailey, our next guest, who both of them have had incredible stories about what they're doing in the workplace. But I'm going to go ahead and let Eric introduce himself as well.
Hi, everyone. I'm happy to be here today, and it's nice to be collaborating with Kentuckians today. I've missed my trips to Kentucky, and I've been involved in I was involved in the Kentucky Chamber of Commerce Opioid Task Force for about a year, and had an opportunity to really work closely with a lot of you, and so always appreciate this opportunity. For those of you that don't know me, so I oversee the substance use disorder and opioid strategy for Anthem, and that includes integrating how we're going to be working with Beacon Health Options as we acquired them about a year ago, so we're in the process of combining forces. So from a behavioral health, substance use disorder medical perspective, I will say that as I work with my team to come up with our strategy for 2021, one of the things that will continue to generate momentum is the importance of approaching substance use disorder treatment from a holistic perspective. So what does that mean? What that means is that we look for opportunities to integrate treatment between medical, mental health issues that come up, substance use disorders. I mean, this is a very complex chronic condition that can exist for people. And in the workforce, that represents a fairly sizable percentage of people who with a substance use disorder are gainfully employed. So these are your employers. And as I was prepping for today, and I'll kind of leave you with this thought, I was looking through some statistics, and one of them, I went to the National Safety Council. They have a great website that talks about impact of substance use disorders and what's the cost to the workforce. The first paragraph that I read was the typical worker misses 3 weeks or about 15 days annually for illness, injury reasons other than vacations or holidays. And then it goes on to say workers with substance use disorders, however, miss 2 more weeks annually than their peers, averaging nearly 5 weeks or 24.6 days a year. And I thought, no way. That's significant. And the point in that is that when we work together and we collaborate between the payer relationships, the employer, and then of course, HR departments and initiatives such as the opioid task force and so forth, we really need to get to the point where the folks that are struggling with the substance use disorder are being adequately treated, so we can bring down some of those numbers and ensure that your workers are healthy and happy.
Absolutely. And now we're going to move to Kimberly Pate, and then we'll get started on some of our other discussions. So Kimberly, go ahead and introduce yourself and let us know about your role in this space.
Yes, I am fortunate enough to work with Patrick Coleman at Landmark Recovery. And I've been in the industry for about 8 years. And I have worked with multiple treatment centers in various roles. But what I do with Landmark is I'm a strategic account manager. And so I am the referral relations communications person. So I am the one that the employers go to. I'm the point of contact for employers, for ESSPs, for EAPs, for communication while their employee is in our care. So this is Fimla, this is short-term disability, this is weekly updates, any kind of progress, any kind of concerns that we've had with a patient. It is making sure that the employer gets all the information they need while they're in our care. So that is my role.
Awesome. Thank you so much. Thank you all for the introductions. And we are going to go ahead and get started, starting out talking about the employer side. Basically, like Eric said, and when Eric talked at our recovery conference 2 years ago, that was the first time I had heard, and it really hit home with me, that most of the people who are struggling with substance use disorder are gainfully employed. So we're talking about people in Kentucky who work at places like Ford, who work at places like LG and EKU, who work at places like Anthem or anywhere else, any other company in Kentucky. So I want to start with Amanda on this one. I know that LG and EKU has been doing a lot of innovative things to make employees feel safe coming forward and kind of getting the help that they need. So if you don't mind to kind of talk about some of the ways that you guys are doing that at LG and EKU.
Yeah, great. So we have been on this journey for quite a long time. It's definitely something that doesn't just happen overnight, and by no means is it a turnkey program. The further you get into it, the more you realize you need to change and alter what may be going on. And again, kind of as everyone continues to hear, 2020 has really shown that to us. But to back up a little bit, we're a utility company. Safety is top priority for everything that we do at this company, whether you're in a power plant, whether you're a line worker, or you're sitting in an office primarily like myself. And so starting to link the two of those together has occurred really over the past couple of years and at the leadership level in order for our employees to work safely, not only for themselves, but for the community. They themselves have to be well, and that encompasses the whole body. It's not just a physical component, but it's a mental health component as well. So for the past couple of years, we have really tried to integrate mental health on any way that we can, whether it's from just, speaking at meetings or making it an actual requirement that people have to check their mental health. And so it's basically something that they do and read some information, but it's part of our medical premium differential. And so that is one of the requirements that they have to do. A couple of years ago, my manager, Deanna Hall, she actually wrote a letter to the entire organization promoting mental health. And she told a personal story from her own family of how the resources that we have, which for this one, she used our employee assistance program, and how it helped that family member through that journey. It's kind of eerie to think, because in February we had our annual Wellness Champions retreat. So, we are across the entire state, and we had all of our wellness champions come together, which we have about 60 to 70 people that are really those champions at these various locations. So we all had our annual retreat in February prior to the pandemic hitting, but for the first time ever, we actually did a mental health panel. So I was the moderator with that, and we had 3 other employees who each told their own story. So one of our managers, he told his story about his daughter and her issues with substance use. And it really was, this accumulation of so many things. We had another employee tell her story of the journey of her daughter. And then our third employee shared their story as well. And so it really opened up that safe zone that we're all struggling with issues. From the outside, it looks like we have this picture perfect world, and you just never know what's going on behind closed doors. And so really starting to break that stigma and for people to see firsthand, okay, this is an issue and this is how we go and get help. We also really try to focus not just on the employee, but that family member. If you've heard me speak, you've probably heard this example, but if your power goes out in the middle of the night and you have somebody who's restoring that power, you want that employee focused on their job to ensure, for one, that you can get your power back, but they're doing that in a safe manner and they're following all of the training and procedures that they have. But if they're worried about a family member, their son or their daughter, because they haven't been home for 2 days, that's probably not the person that you want helping restore your power in the middle of the night of a storm. And so really focusing on that family component has been one of our main goals, and continue to hit. It's just not the employee, but that entire family unit.
Absolutely. And that's an incredible point, because it affects any of mental health issues and substance use disorder. And I think it's so critical to talk about the mental health component too, because we need to be addressing that, even if it doesn't have to do with substance use disorder as well. So I think that's an incredible point. And I want to talk some about policies. So Eric, I'd love to move to you. And especially, I told our panelists before we got started today that I'm learning along with everybody else. These are my favorite type of panels, because I'm asking questions because I don't know the answers and I'm learning with you guys. So Eric, especially, I'd love to hear about some of the internal things that you guys are doing for your team that work at Anthem, but then also I think a lot of things come up in people's minds about insurance coverage, and is treatment going to be covered, and how do I pay for this, and things like that. So what does that look like, and how are you helping your employees or other employers understand what that looks like as well?
Yeah, that's a great question. And it really, some of the answers, it depends. Certainly organizations that have 50 plus employees are going to have different opportunities for setting up their coverage and benefits and so forth. And I will say this, that the products that Anthem offers, with ACA that went into place in 2010 now, it's been 10 years. So, there have been some tenets in place that require that mental health is on par with physical. So if physical health is offered, then of course, mental health, if it is offered, it needs to be commensurate and not extraordinarily more expensive and so forth. So over the past 10 years, Anthem, along with all the other payers, have taken the approach to make sure that behavioral health services are intertwined into the coverage when it comes to treatment. So let me say this, that in the commercial insurance world, we do have a bit more latitude than we do with like some of our Medicaid states, because Medicaid is different from state to state. So Kentucky's different than Indiana and different than Ohio, and so on and so forth. But with commercial plans, for the most part, the full spectrum of substance use disorder treatment services are covered. And what I mean by full spectrum is that typically someone will start with an assessment. So like an outpatient kind of an assessment where there's a conversation about what's going on, how what's the degree of severity for someone's substance use disorder, what's their home environment like, do they have people in their lives that support them, so there are a myriad of things that are considered when determining, well, what's the most appropriate level of care. So from that point, then it's determined, well, how what is the most appropriate level of care? So does somebody need something that's like a 24/7 kind of a scenario in a residential treatment center? Can they still live at home and then go to treatment for maybe the whole day? Can they be in a scenario where they do outpatient services, but maybe a little bit more intense than 1 or 2 times a week? So, those things are all taken into consideration for the levels of treatment. And typically, under the benefit, there would be a cost, sometimes a cost share, depending on how the benefit is structured. And again, it just depends. But Anthem works very hard to make sure that we mitigate circumstances where there may be barriers to treatment, and that can include, exorbitant cost shares and things of that nature. And the one other thing I would mention too, and so opioid use disorder, of course, is still very, very much an issue. And so the medication assisted treatment is still something that's interwoven into the treatment options for opioid use disorders. That includes medications like Suboxone or buprenorphine and naltrexone. So these are medications that are brought in and are a part of whatever level of service that a particular individual would be engaging in. And typically that's covered too, from a pharmacy point of view. And then if someone gets like sometimes people will get an injection, intramuscular injection of one of these medications, and it'll last for like 30 days and help them kind of get established and then sustain long-term recovery. So, those that can get kind of expensive. So, that's also covered typically under the pharmacy benefit. So the last thing I would say is that it's important for, any employer to be fully aware of what is it that you are offering to your employees, and to ask the tough questions of the payer and say, well, what about this? And what about that? And, tell me more about, how we can maybe bring down the cost share, for this, and what's going to be the impact of the total cost for that. So these are very, very important conversations to have going into that creation of the benefit structure.
Absolutely. And Kimberly, I want to move to you because again, I'm learning too, and just hearing you introduce yourself and what you do, that even brought up things for me about what this even looks like. So once someone, comes forward and we find out that they have substance use disorder and they need treatment, like you said, you're the one that takes the process of like how it's paid for, FMLA and things like that. I wouldn't have even thought of that. So if you don't mind to talk about what this looks like once someone does go to treatment on the other side of things, that would be a great place to start.
Well, usually when the patient admits, we make sure that releases of information are signed for the employer. And we also make sure that any kind of claim is started upon admit. So we want to make sure that this process is immediately started so that the patient can be paid while they are on leave. So we make sure that that happens. And then within a few days, the patient will meet with a case manager, which we call patient advocates. And so these patient advocates are there to help the patient fill out the paperwork, make sure that we have all our I's dotted, T's crossed, and make sure that we get everything taken care of on the forefront, like just up front. So making sure that that is done. And then what I do is I send weekly progress updates. And so that makes the employer aware that the short-term disability, the Fimla paperwork is completed. Or if there are any kind of issues, we will reach out to the employer to see if they could help. This also is just to make sure that the employer is up to date on the status, whether the employee is progressing or not. So that is just a few things that we do, but right up front, we make sure that that paperwork is started. Does that answer your question?
Yeah, absolutely. And Patrick's point earlier about when you guys say to someone, let us handle what's going on at your job, you focus on getting your recovery. I thought that was such an important point. And to hear the way that you guys handle that is incredible. And Patrick, I'd love to talk to you about, so a couple things here. First of all, I've heard a couple companies talk about if someone tests, ends up having a failed drug test, sit down with them, have a conversation, and instead of saying you're fired, they determine the severity of the situation, decide if they need to go to treatment or something else. And sometimes also there is situations where they'll come back after treatment. If they get another strike, then so on and so forth. They have a structure in place. Some companies are trying to go to those type of policies. But also we hear all the time that with workforce issues that we can't find people to hire because no one can pass a drug test. So in terms of where you see people coming to recovery, is it in the beginning or is it in the middle of their career? And how do we get to a point where we're making sure everybody has a fair shot to get the help that they need?
Yeah, that's a tough one to answer directly, I guess, but the best I can do here. Let's see. So at my center currently, I would say over 85% of the people in my center are gainfully employed and have been for a period of, I'd say, 2 to 5 years at a minimum. There's the other side too of the 20 plus years as well. But mostly what I'm seeing are employees between, let's put it like 3 and 7 years is kind of the most average tenure of an employee that comes to our center. And what we're seeing, I think a lot of it is starting prior to employment. It's no secret that a pandemic didn't start overnight, or an epidemic didn't start overnight, I'm sorry. With the opioid crisis, this is something my generation has been struggling with for 10 plus years. And, you made the decision to hire somebody in their early 20s in 2009 to 2010, you got one of us, I promise. And that's just kind of how it happened. A lot of people came, drugs and alcohol were everywhere. It was readily available. Pharmaceuticals were easy to get your hands on. And then we all graduated from high school and went to college, got out of school, and now we have our degrees and our addiction alongside of us. But it's a new generation of people to where we have the ability to still have like a blue collar or a white collar job and dress very appropriately and not look like your typical drug addict or alcoholic would until after we've passed that first initial drug test, right? Because anyone can pass one drug test once, no big deal. We can figure out a way to make that happen. But it's the afterwards is when you start to see just kind of the impact you have. And I'll use Ford as an example just because it's something close to my heart. Ford didn't start the epidemic. Ford didn't introduce drugs and heroin to Louisville, Kentucky. It was already there, but Ford made the decision to hire from this community, and this community was struggling with substance use disorder in the worst way possible. I can't even think of a big enough word to put in place of it, in the worst way possible. And so doing so, you are going to get those members of the community that are struggling with substance use disorder, fortunately or unfortunately. I'd say fortunately, because once those people do get sober, they're some of the most creative, hardworking, inspirational people I've ever worked with. I'm not just saying that because I am one, but saying that because I've seen it as a whole. But on the other side, yeah, the ones that I see that have been with a company a long time that develop a substance use disorder, it's something that happens over a long period of time. It's very similar to the story I told where they get prescribed some pain pills because the arthritis in their hands from holding the drill hurts for so long. And then those pain pills stop working after 2 or 3 years, and they've upgraded and they've upgraded and they've upgraded. And then what I see more of is people in their mid 50s, early 60s that are on a very, very high dose of pain pill of some sort or another that want to come off of it. And they went to their doctor and they told their doctor, hey, I'm done with taking these pain pills, take me off of them right now. And the doctor says, unfortunately, you are dependent on these pain pills and you're going to have to go detox your body from them if you want to come off of them. So that is the two majorities of what I see in my center as far as the workforce goes.
And I'm going to kind of open this up to anybody who wants to answer, but I think that the employee assistance programs, and I'd love to hear more about them, but also from what I understand, they're pretty underutilized. And I just want to hear from any of you guys about how to get people more involved with this, how to again, make them feel safe enough, and just mainly, again, education about what it looks like if you do come forward, because I've already learned so much today about, like Patrick said, let us handle your job. You worry about your recovery. I think that most people are scared to lose their job if they come forward. So I guess either Eric or Amanda, if you want to start on the employee assistance programs, what that looks like for someone, and how you guys kind of encourage people to utilize them.
Yeah, I can kick that off. And I mean, the one thing I would say is that, and I've known this for a long time with our SED strategy, that, you know, we've spent, and rightfully so, we've spent a lot of time on addressing the opioid epidemic and you know, the moderate to severe cases of substance use disorder. But when you look at the statistics and the numbers, the vast majority of people struggling with the range of substance use disorders are low to moderate severity. So for those of you that know it, there's this book called the DSM-5, and it's a big thick book. I've got it on my shelf here somewhere, but it lays out a framework for how do you determine severity of a substance use disorder, whether it's, you know, the drug of choice is opioids, or maybe it's multiple drugs that somebody is interested in. Maybe they have a severe alcohol use disorder, but a low to moderate cannabis disorder, you know. So there's a range. So that range of people that falls from that low to moderate, they are, for all intents and purposes, they are at risk of getting to a point where they cross the threshold into a more severe, kind of like Patrick was describing. Yeah, you know, it started through a medical situation in that case, but then started to creep its way into something more than that. And it didn't just happen overnight. This happens over time. So the beauty of EAP, and I agree, it is significantly underutilized, but it's free. It's something that is confidential, and an employee can go, and when they're in that low to moderate, where they're not thinking, gee, I need to go to a treatment center. Someone just told me that I drink too much. Maybe I should go talk to somebody about it. It's kind of that first door, that first opportunity to kind of open up that conversation. And if we're able to start that earlier on, we're more likely to mitigate a circumstance, at least with a particular individual, that it'll continue to cascade and get to a point where it becomes more problematic. From an employer standpoint, that's a really good thing, because you're making an investment in that employee, you know, because as I mentioned at the top of this call, I mean, the last thing you want is someone who's taken 24.6 days for you know, illnesses and other things that are related to an unchecked substance use disorder. So the earlier we can have that conversation, the better.
Absolutely. And Amanda, how would you encourage employers on this call who are looking to help their employees in a new way, or, you know, kind of find ways to be more recovery friendly? What first steps would you encourage them to take? Because I think that's probably a big concern of a lot of employers. They don't know where to start. They want to help. They know this is an issue. They know it's a workforce issue. To Eric's point, people are missing work there. And to your point, they're not focused on what they should be focused on. So as an employer, how do you take the first steps to accomplishing this?
It's a lot. It's, you know, and it's kind of, where do you start? You know, as I stated, we've been on this journey for several years, and we don't have all the answers. And so just starting out, it doesn't have to be a huge piece, but, you know, there are really kind of two things that come to mind. One is the EAP piece, and having a substance abuse program built within your employee assistance program. For us, that is pivotal to us. For our folks that need that assistance, let that substance abuse program professional guide that person's journey through that. That is not something that your HR department should be guiding, or that employee's manager. That is a relationship that is between, you know, whether it's an employee or the family member, through that professional who can guide their journey. The other piece that I would really like to hit on, and Eric kind of mentioned this, is, you know, all of this costs money for employers. There's no way about it. But as employers, we have got to start to shift our mindset of this spend that is a large spend for us, whether it's investing in the employee assistance program, which I would really highly encourage people to do, but also on the medical and the pharmacy side. But, you know, when we think of preventive health and for women and getting their annual mammograms, and for men, you know, having those annual checkups, that is spend that we encourage and we want to see go up, because that preventive health helps everything else along that person's journey, even through retirement. And mental health needs to start to have that same approach. So investing in these programs, investing in recovery, investing in medication assistance therapy, you know, if you start to see that spend go up, I view that as a good spend. People are getting the help that they need, and they're finding out hopefully what works, because on the back end, it's just going to pay off, whether it's from a productivity piece. And then of course, you know, all of the components of their health start to get better and with that. And so eventually you would kind of see that go to the other side from a cost perspective. So looking at it as an investment from an employer perspective is really key.
Absolutely. And just for employers on this call, I'll share from the Kentucky Chamber's perspective too. In the last couple of years in particular, obviously, we're now involved in this type of work and helping other employers as well. But if you've been involved with anything with the Kentucky Chamber, you've probably heard from Ashley McCarty on our team, who has an incredible recovery story as well. And just being more open within your organization, just like Amanda said about the senior level employee who sent a letter talking about it, being honest. And this is about mental health. This is about recovery. This is about all things. Because the more open you are with your own people, the more comfortable they feel coming forward, and the safer space that you have in terms of making your employee, or making sure you get what they need. So now Patrick and Kimberly, I'm gonna switch to you guys for a second. Neither of you can start. Let's talk about the pandemic. Nobody's sick of talking about coronavirus, right? Let's talk about it. Obviously, it's had a huge impact on the recovery space. We are in a place, especially in the beginning, more isolation, which is so hard for recovery. We're out of routines. We're all at home rather than doing our work, and so on and so forth. We're out of our safety nets in a way. You know, the people, especially if you're in recovery and your employer has invested in you, like the last two employers talked about, I've seen that a lot of people feel very, loyal to them, and they want to be there doing the work, doing good work. You're out of your routine now, and you're away from your coworkers and things like that, which makes recovery even harder. So what does that look like on the recovery side in the last almost a year now, unfortunately? How has that impacted you all's side of things?
Kimmy, cool if I start? Good. All right.
It's all you.
So I think before I start, I do want to say, in agreement with the last two panelists, there's this thing called the ASAM, and the ASAM is the American Society of Addiction Medicine range, right? And so they gauge what levels of care somebody can be provided. It goes all the way down from a 0.5 all the way up to a 4.0. A 4.0 would be like your detox center, your medically assisted treatment, and a 0.5 would be what we call an early intervention. So often we want to jump 2.5 and above immediately. It's the first instinct. Let's stick them straight into a treatment center. But I promise you, there is levels of care 2.1 and below. And if we started the scale and had the mindset as a company, as an organization, to start from the beginning and work our way up the scale with those that are appropriate, we would see a much higher success rate than shoving someone into a treatment center who is still at the early intervention stage. And it's like shock therapy to them. They have no idea what they're walking into. They're seeing somebody banging heroin into their veins, and these people are drinking a couple extra beers on the weekend. It's a completely different mindset. And what it does is it exposes them to a whole new level of care, but it also exposes them to a whole new level of addiction that they might not have seen otherwise. So instead of starting somebody and just throwing them in the deep end of the pool, let them start on the shallow side and walk their way in if it's appropriate, if it makes sense for their level of care, if their use history presents in a way to where they wouldn't have a significant detoxification process that would cause a medical emergency or an issue like a seizure or something along those lines. But yes, just wanted to say thank you for saying that. I appreciate that. Too often we have somebody bring somebody into treatment and we're like, hey, have you heard of IOP? Let's start there. Let's work our way up. So from the pandemic standpoint, it's been really intense. That first month, month and a half, maybe 2 months, the death tolls were just trickling up and up and up and up. And I remember somewhere in the first 90 days of the pandemic starting, there was 14 people that were close to me in some type of way that died in a 10-day period as a direct result of overdoses. And it was just one after the other, after the other, after the other. And it's done a lot of really hard and a lot of really great things for the recovery community. The recovery community as a whole isn't something that I would call innovative, isn't something that I would say is very forward thinking at all times. A lot of cases, treatment centers and recovery centers in general had a really great idea that worked in the 80s or worked in the 90s, or they found recovery dynamics or something along those lines at some point in the past. And we're like, hey, this is great. We're going to run with this the rest of our life. And then what happened when the pandemic hit, it forced all of the centers who didn't want to change or didn't want to become innovative or wanted to stick with the way that they've always done business, was no longer able to do that. It forced them into change. It forced people to adapt Zoom calls. It forced people to adapt online meetings. It forced people to sit into a room and be alone with themselves and know what it's like to sit in silence. It took away a lot of the excuses that we have not to go to a meeting because I'm busy. I got to watch the kids. I can't get a babysitter. I can't do this. I can't do that. It did a lot of amazing things because now you're stuck at home anyway. I understand you're stuck at home. Now you're stuck at home with a meeting. You know, if you look back just 2 years ago, I'm a person in recovery. Like I said, I sponsor people in the program that I choose to work. They're called sponsees. 2 years ago, one of my sponsees said, you know, I don't think I'm going to go to a meeting this month. I'm just going to do them all online. I wouldn't have let him. I would have said, no, absolutely not. What are you kidding me? Part of getting sober is going to these meetings. And then what we find out later is just that's just what we were comfortable with. That's just what we were used to. That's the way it always had been. Doesn't mean it's the way that it always has to be. So what I've had the privilege of doing now is I get to sit in meetings sometimes in Rome, in Greece, in New York, in California. I've sat in meetings all across the world that I never would have sat in otherwise, and got to hear stories and hear a story in Europe that I can say, oh my God, I relate to that. Exactly. And I went through that same thing. Thank you for sharing that. So as a whole, the pandemic was a hard hit in the beginning. It was a hard hit because we weren't prepared to change. The industry wasn't prepared to change. The industry didn't have to change because the industry made the rules for the most part of how people got sober. And what we've seen since the pandemic hit, the rules have changed. And now we've had to adjust the way that we get sober as well. Still working. There's people right now that are coming up on a year sober that got sober right as this thing began. So it's still working and there's still hope.
That's incredible. And Kimberly, I'd love to hear from your side. Have you seen more of a disconnect between employers and employees without being in the office and not seeing these symptoms firsthand or anything like that? And was there a difference between the beginning of the pandemic versus now in terms of an influx of people or anything like that?
I've seen a lot of employees come in without notifying their employer. They come in because they are at home and they would like to, they're either, their shift has been on hold, what have you, but they have more time at home. They have more time to drink. They have more time to do drugs, flying under the radar, as you say. So we have had a few employees come in without notifying the employer. In that case, we do encourage them to notify their employer and utilize their EAP and utilize their short-term disability. Before the pandemic, no, we didn't see a lot of that at all. We would basically hear directly from the EAP or the employer saying we have an employee who needs your care. So we've seen a little bit of a shift in that. However, as we reach the end of the year, it has kind of gone back to how things were prior to the pandemic. So we see a little bit of both now.
Are you seeing more people than you saw pre-pandemic come to treatment or around the same? I know that's a hard question to answer.
Back at the beginning of the pandemic, yes, we saw an influx of people coming to treatment. And I think a lot of that was the isolation, the financial part of it. the lack of coping skills, what have you. So we saw a lot of that, but as the year comes to an end, that we're seeing is getting back to the normal flux of patients coming in.
And let's talk, I know Eric said earlier that his team was already talking about 2021 strategies. I'm sure you guys have been talking about that for a while. But we are all starting to think about what life looks like when we get back to normal. Nothing is going to be ever normal again. I think we're going to have more people working from home. We're going to have more of these things. But what are we looking at in terms of post-pandemic? How do we start preparing for that now? What does that look like? And I'll open that up for Eric or Amanda to start with that one.
Yeah, I mean, and I'll start that off, Amanda. From my perspective, I mean, there are a number of things that we're doing post-pandemic, and to piggyback off something Patrick said. And Patrick, by the way, it's so great to be on a panel with you again. You've got so much energy and enthusiasm around that. I really appreciate it. It's infectious. No pun intended in this COVID environment, right? So anyway. But post-pandemic, what are we getting geared up for? I think it's, and I want to point out one of the things that we've been focused on over the past year and will continue to be focused on in 2021 is our deep relationship with our providers. And I have so much respect for how quickly the providers in our network have managed to make the shift from like even a completely brick and mortar scenario to propping up a situation where their patients could continue to get treatment through virtual means. And for some, it was easier than others. For some, they already had the infrastructure there. And to Patrick's point, there had been no impetus to really pressure test it. But when they flipped the switch, they found that not only did patients appreciate it because of all the reasons Patrick mentioned, all the barriers being brought down and so forth, but the engagement rates actually have gone up with treatment for people that are participating. No-show rates have gone down. So that's been kind of extraordinary to watch. So what we're going to see in 2021 and beyond is that there's going to continue to be a hybrid approach. There will always be a need for in-person, depending on the levels of care that Patrick mentioned. The higher levels of care will require that in-person kind of a scenario, and to some extent on the lower end of the spectrum as well. But they're going to be more opportunities for thinking outside the box and engaging people where they're at and with what they're ready and willing to do, and bring down some of those barriers. Particularly important in the rural areas. I mean, Kentucky alone, think of all the mountainous areas where it's hard to get from one part of the state to another, and when there are dramatic differences between communities and so forth, it plays a very important role. That's one piece. And the other piece I would mention, and I'll turn it over to Amanda for her thoughts, but from a federal perspective, we're looking at taking down some of the barriers for the practice of telemedicine. And what does that mean? So what that means is that we're trying to make it, or we're advocating to make some of the rules that have been put in temporarily during the pandemic, during this emergency situation, to make some of those rules permanent. And some of those rules include, the ability to practice telehealth over state lines. So, that what that means is that, someone could be sitting in Indiana, but able to treat a Kentuckian, and by virtue of having some of those virtual treatment options. And, frankly, some of the border licensing requirements have been somewhat arbitrary. And I've always thought, well, why don't we open this up? We have a workforce shortage. We really need to open this up. And if we do that from a regional perspective, however we decide to structure that as an industry, some of those things are yet to come, but thinking outside the box will be important. The one other thing I would mention, this is very important, is that the Ryan-Haight Act, which requires the an in-person visit to initiate Suboxone or buprenorphine for the treatment of opioid use disorder, requires a face-to-face visit before virtual coverage can begin. That's been temporarily suspended, and we're hoping that remains permanent so that people can go ahead and get a prescription for buprenorphine online. If they're in the emergency room, there's nobody there with a buprenorphine waiver to get that prescription initiated, to have that person be able to connect with someone while they're there to a virtual service would be incredible. to be able to get the train running and help that person get connected with treatment right out of the chutes.
Amanda, I'll go ahead and turn it over to you.
Great, thanks. Yeah, we actually, so we, over the past couple of years have been able to kind of see this decrease, whether it's from a pharmacy standpoint related to opioids or even the benzodiazepines, and then the pandemic hit and it was like we kind of went back a couple of years. And so there is no doubt that this has had a huge impact and will have an impact for years to come. I mean, it will be years before the communities start to really recover from what we've been through since March. But, not to hit on the things that Eric said, because all of those are spot on. We've had telehealth for so long, but it's like through this, it's like, oh, we have this. And, but it's really reminded me and my group, we can't just assume that people know about telehealth. We can't just assume that people know how to access their employee assistance program and who to call. And so really having those messages, but continuing to say them over and over and in different ways. And I think too, we've kind of gone back to where we were, or, maybe what we were doing 10 years ago or so, but just talking to people. I was on a call last week with an individual, and it was through Zoom, and I had seen that individual for a long time, and it was a group setting, but, it was very evident that something was going on with that person. And so just going back to those pieces and really connecting with people and making it a safe place. There's no judgment. Here's what it is, and here's how you can get help. But just talking to people, I think is something that we're all going to have to work on. I'm guilty of that as well. That this virtual world, I think, is going to create an even tough issue and something that we need to overcome with that.
Absolutely. And it is almost time for us to start wrapping up, but I want to make a couple points real quick, just based on everything that everyone has said too. In terms of the pandemic, we've also seen that as the unemployment rate goes up, overdose death rates go up significantly as well. For every 1%, I think it's 3.6 or something percent that the overdose death rises, which is unacceptable, obviously. And the pandemic has hit everyone hard, from employers to employees, people struggling. But we have to keep those things in mind as we move forward. I want to let all the people on the call today know that the Kentucky Chamber has our Kentucky Comeback program that we launched this year. If you go to KentuckyComeback.com, shameless plug, I would love for you to sign up for the network on that page. But basically on that, we have Who's Hiring, which has positions open for people who are in recovery or who need to find employment, and especially those who are willing to give a second chance. That's on that page. Employer resources, different policies that you can look at in terms of, you can literally just take them and use them on your own. Our Workforce Center has done an incredible job putting that together. And we're really going to be asking for help to push policies to help avoid a lot of these things we're talking about today, change state laws in order to improve and move our state forward. So again, KentuckyComeback.com. I would love for you guys to go find all of those things. And just so everyone knows, this discussion today is being recorded. We'll be posting it afterwards. And the panelists and I talked ahead of time. Any resources that they want to share with you guys, I'll also include an email to everybody who registered. So just know that'll be coming your way as well. So now finally, to wrap things up, I want to hear final comments from everybody. I think I've seen Patrick taking some notes, but also I want to have you guys say whatever you would like to say to employers, final message of how to get started, how to do this, how to help people within their own organizations and kind of move forward. Patrick, I'll start with you to give your final comments.
All right, great. Thank you. So yeah, let's see. A couple things I guess I'll end with here. Just because there's a pandemic doesn't mean you can't have a sobriety date. I think I would start there. I was looking, there's roughly 85 people on this call right now. Out of those 85 people, either one of you personally or somebody that's in your household is struggling with substance use disorder. That's just a fact. Know that there's help out there, and know that help doesn't always mean to jerk them out and shove them in a treatment center. Working in a treatment center, I'm telling you this, there is other options out there. And then another thing, as an interventionist, I'm always going to put a plug in for interventionists because I think it's such an underutilized tool. For me, doing an intervention, what it means is I get to sit down with the family. I get to assess exactly where they're at in that current moment. I get to help them put a family plan together for how they're going to best serve their needs. I get to work with the patient one-on-one, deciding how bad is their situation, what barriers do they have. I get to come into their home. I get to see their home living environment. I get to see what triggers they could have and obstacles they could have at their disposal, at their fingertips, at their home. So treatment centers are a lot like restaurants when you look online. Every treatment center is going to tell you they have the best burger, that they're the best treatment center. That's what we're supposed to do. We market towards people. That's the goal of this industry, is to market towards people to get you into our treatment centers. So every treatment center is going to tell you that they're best fit for you. How do you know if it is or if it isn't? You hire a professional that understands everything inside and out of the industry, and they help you find either the level of care, the treatment center, or the treatment plan that you need to get back into everyday life. Let's start targeting more towards the families than just the addicts and alcoholics, because the family members are also the ones that are suffering. Too often in treatment center settings, I see situations to where the employee gets the help they need, but the employee's family is still suffering. The employee's family is still sick, and they're not offered things like individual therapy, family therapy, marriage counseling, things along those lines. So if I was going to help work to try to fix and make a change in this industry, in this country, I would say start small. It's the small things, looking at the first levels of care, the first interventions, looking at information around what treatment centers actually offer versus what you actually need, the medications you're taking versus the medications you actually need. I would start there. And if you need resources, help finding an interventionist, that's something I can definitely provide. I know plenty of really good ones in the area. But I think that would be my final statement, is prior to making the call and deciding that your son, daughter, loved one is ready for an inpatient level of care and needs detoxification, reach out to a professional first and get evaluated prior to making a decision. Thanks.
That's perfect. And Ashley McCarty on our team, who I gave a shout out to earlier, actually put in the chat that she needs to talk to you, Patrick, about somebody. So that is an excellent point, because I think that we all probably know someone and don't know how to get started on that process. So now I'll go ahead and open it up to any of our other panelists who want to give their final comments.
Thanks for having me.
I'd just like to say Oh, go ahead.
Sorry, ladies.
Just from an employer standpoint, focusing on the whole person. It's not just one thing that they may need help with, and so really focusing on that, and creating that safe, confidential environment. But at the same time, employee testimonials are huge. And word of mouth, and you can have one champion that can make a huge positive impact on that workforce. And so just don't discount that as well. Thank you. I'm done now.
Thank you, Amanda, and Kimberly, we'll move to you.
Well, I was just going to follow with Patrick. Really, I believe that I've been working with multiple treatment centers, and I believe that what we've done a poor job at is educating employers, educating the community on substance use disorders. And so I feel that the employers and the treatment centers to really work together to educate the employers about the substance use disorder and how it's affecting the community and what they can do to help their loved ones or help themselves.
Eric, we will wrap up.
Yeah, and I'll keep this very brief. I know we're a little right at the top of the hour, but again, thank you for this opportunity to talk with all of you today. And I think this is a little bit of a shameless plug for Shatterproof.org. If some of you aren't familiar with Shatterproof, one of the things that they do is they have a anti-stigma curriculum that's specifically designed for employers. It's like little 5-minute videos that employees can look at to learn a little bit more about substance use disorders, what they are, what they aren't, and so forth. That's one example. I mean, there are other examples too of you can certainly work within a number of different organizations to do that. But it takes a champion. It takes a champion who's willing to take a risk at a high level within an organization to demonstrate, the destigmatization of substance use disorders. And everyone has mentioned, I mean, the people that struggle with substance use disorders are most often are gainfully employed. They're in the workforce. They're right there. So it's very, very important that you set the tone that this is nothing to be ashamed of. It's a health issue. It's something that we should treat with every bit as much compassion as we would diabetes or heart disease. So again, thank you very much for having me today. This has been a wonderful conversation.